Recording in progress. Good morning, Dr. Edward.
Good morning. Can you hear me?
Yes.
Can you hear and see me?
I can't see you, but I can't hear you.
Oh, man. You can't see me?
Okay, now perfect. Yeah. Now
You
I
see
can.
me now?
Yes, we see you now. So we are waiting to start the event in about 7 minutes, yeah? Thank you for taking out the time. So we'll start in 7 minutes.
Okay, that's great.
Thank you.
Good day, ladies and gentlemen. Greetings to all of us. We extend our warmest welcome to the distinguished speakers, guests, researchers, policy influencers, and relevant stakeholders around the world. My name is Rizky Ramadan, and I am going to serve as the master of ceremony for this webinar. And the title of today's webinar is Sustaining Economic Growth by Managing Tuberculosis in the Workplace, presented by the Think Tank 20 from G20, CHAMPS Universitas Indonesia, and Strategic ASEAN International Advocacy and Consultancy, or SAIAC, supported by Johnson & Johnson. Before we continue with the event, we would like to deliver our warmest greeting to our honorable guests, the Minister of Health of the Republic of Indonesia, His Excellency Budi Gunadi Sadikin, who unfortunately is unable to join us today due to health issue. Our team wishes His Excellency a speedy recovery. And to speak on his behalf later on is Dr. Maksi Rein Rondonuwu. We also would like to extend our welcome to the Chair of Healthcare Working Group 1 and also the Director General of Disease Prevention and Control, the Ministry of Health, Republic of Indonesia, Dr. Maksi Rondonuwu, the T20 Lead Chair, Professor Bambang Brojonegoro, Executive Director of Global Funds, Mr. Peter Sands, the Vice Chairman of Commission 9 Indonesian Parliament, Mr. Charles Honoris, the T20 Task Force 6 Lead Co-Chair, Professor Hasbullah Tabrani, and the co-chair of T20 Task Force 6 and also the founder and CEO of SAIAC, Ms. Shanti Samdasani, and other respected panelists and speakers. Ladies and gentlemen, as we all know, tuberculosis continues to be one of the world's leading infectious killers. In 2020, 9.9 million people fell ill with tuberculosis worldwide, and 1.5 million died from the disease. In places where it is widespread, tuberculosis hurts the livelihood of the entire communities, slashing incomes by billions annually. Data shows that tuberculosis affects many low and middle income countries. G20 member countries account for over 50% of all new tuberculosis infections and nearly 50% of all deaths due to tuberculosis. Since 2017, the group has been committed to addressing tuberculosis, which has been mentioned in all G20 ministers of health declarations and in the majority of heads of state communiques. Ladies and gentlemen, workplaces are an important entry point for enhancing employee health. The COVID-19 pandemic has demonstrated that further efforts can be made to strengthen the role of workplace health programs in responding to and preventing the spread of disease, as workplaces are prime location for the spread of other respiratory pathogens, including common colds, influenza, and tuberculosis. For businesses, these health challenges represent risk to productivity and output. Therefore, today's webinar will talk deeper about how managing tuberculosis in the workplace could result in sustainable economic growth. Ladies and gentlemen, to start, I would like to invite the T20 Lead Chair, Professor Bambang Brojonegoro, to share with us his opening remarks. To Professor Bambang Brojonegoro, the screen is yours.
Very good morning, esteemed speakers, ladies and gentlemen. In the midst of struggle to rise from COVID-19 pandemic that has hit the world, the G20 presidency this time carries the theme Recover Together, Recover Stronger. This theme is major goal and direction for policy recommendation to be produced by the Think 20 or T20 as the official G20 engagement group that brings together leading think tanks and research centers around the world. TB, or tuberculosis, continues to be one of the world's leading infectious killers. It is a disease that strikes people in their prime working years, which prevent them from supporting themselves and their families. In places where it is widespread, TB hurts the livelihood of entire communities, stressing incomes by billions annually and shrinking the potential size of the market for goods and services. In 2020, there were 9.9 million people who fell ill with TB worldwide, and 1.5 million died from it. It is worth noting that G20 member countries account for over 50% of all new TB infections and nearly 50% of all deaths due to TB. Since 2017, the group has been committed to address TB, which has been mentioned in all G20 Ministers of Health declaration and in majority of heads of state communiques. Learning from G20 countries, which had lost the equivalent of 236 million full-time jobs in 2020 and 2021 as a result of COVID-19, it is apparent that high level of industrialization in these countries make them particularly vulnerable to the economic and social impact of respiratory disease transmission in workplaces. As such, the intervention which will be discussed in the policy dialogue is intended to strengthen the health and resilience of workplaces, which are particularly significant for the G20. Distinguished speakers, ladies and gentlemen, through this forum, what we want to convey is that occurrence of TB in workplace is an issue that leads to non-productive hours as well as continuous link of TB transmission that would hinder our battle against the disease. Therefore, it becomes important to ensure early detection and proper management of TB in the workplace through active screening activities and other initiatives by taking lessons learned from existing efforts throughout the world. Policy and law should be in place to support our fight against TB in the workplace, particularly when stigma and false understanding of TB remains an issue in the society. A support system for workers dealing with TB becomes necessary to ensure treatment completion and for them to return to work as quickly and as safely as possible. It is the responsibility of all stakeholders, including the government, the healthcare sector, private sectors and industry, and the community to join hands in a partnership to support this health initiative and achieve our common goals. Resource collaboration between stakeholders is the backbone of service delivery. Companies in particular can have a major impact in their workforce communities, acting in isolation, but they also have important voice in national level discussion, helping to shape business environment in which they operate. In this regard, the G20 Indonesian Presidency for Health Sector Task Force 6 organized this dialogue, which was designed to identify harmonization of health-oriented policies that can be carried out to strengthen the collaborative role of stakeholders across sectors. Distinguished participants, ladies and gentlemen, TB is a lethal respiratory pathogen and shares many similarities with disease like COVID-19. Systems that help tackle TB will help protect companies and communities against future outbreaks of similar pathogens. Together, today, we will get an overview, equalize perception, and produce key findings on how to support economic growth by managing TB in the workplace. Let's now invest in ending workplace TB to build resilience against the current and future pandemics, to gain productivity by reducing sickness in the workforce, and to help protect workers, their families, and communities, and ultimately to save lives. Thank you very much.
Thank you, Professor Bambang Brojonegoro, for the remark. Up next to deliver the abstract presentation is the Medical Affairs Lead, Global Public Health, Johnson & Johnson, Dr. Carla Decotelli Mendes. To Dr. Carla, the screen is yours.
Thank you, Rizky, and thank you all for being here today. Thank you, organizers of G20 and T20 for prioritizing tuberculosis as an important agenda, not only for healthcare, but also for the economy. Special thank you to Indonesian Ministry of Health and Global Fund for playing an important role to end TB. We already heard how tuberculosis continues to be one of the world's leading infection killers, and also the data that really comes to us in terms of 9.9 million people being affected in 2020, and also 1.5 million die of it. This impacts not only the individuals who are ill, but also their families, the society, and the economy too. TB, as we know, also impacts those individuals in their productive years. And this provokes an impact to the economy, to also productivity. It can be seen through absenteeism at the workplace when they are not showing for work to take care of, basically because they could not come, but also through presenteeism when they come to work and also cannot be at their best and productive and do all that they were expected to do and all they can do. But why workplace could be a strategic platform to tackle TB and also the TB challenge that we see right now? First of all, really thinking about the workplace, all the different spaces that individuals are coming every single day to perform a task. And this can be seen in office, private office, different industry, government office, lab, supply chain, manufacturing, mining, oil and gas, restaurants, schools, healthcare, hospitals. These are all places that are considered workplace. And we can also use that as a platform to tackle TB and even other respiratory pathogens, as we saw it during COVID. Some of the challenges we see on the TB management, such as lack of surveillance, early detection, case finding, diagnosis, these are some aspects that we could use through the workplace platform to bring some different impact to those individuals. Why I want really to share with you and three main highlights why workplace health programs and intervention could be so strategic for managing TB and other respiratory pathogens. First of all, and we heard this already, the workplace is the entry point to manage population health. These are spaces that individuals are coming every single day. And through that, through the information, through communications, through education, they can really be managing population health, not only respiratory diseases, tuberculosis and others, but even a holistic approach to other diseases and chronic diseases through health promotion. Second, not only it is an entry point for population health, to manage the population, as some groups are coming to work and sometimes they have some challenge assessing the healthcare system. It's also at the workplace can be a place to spread some of these diseases. We know that specific for respiratory pathogens, the workplace and some workplace can be confined space, the close contact that we can see. It can really promote the spread and create an environment for that. And third, the other highlight why workplace could be a very strategic platform is really through education and awareness. Having the employee understanding and knowing and having that information about symptoms, signs, how to access the healthcare system, having those information and an employee empowered of that, he can not only take care of him, but also be an agent of transformation at his home, with his family, and also the community where he lives. And how we are going to do this is really through collaboration. That is why this policy dialogue that we are having here is so important. It's really bringing different stakeholders, each one playing their own role, but not in silos, together to integrate a response on how to tackle and really tuberculosis, other respiratory pathogens, but being able to end workplace TB. Thank you.
Up next, to deliver the summary and data on tuberculosis in Asia, is the Asia Pacific Regional Manager, Global Tuberculosis Caucus, Mr. Ganendra Awang Kristandia. To Mr. Ganendra, the screen is yours.
Thank you very much for having me here. I would like to kindly request the committee to display my slide. Thank you. First, I would like to thank T20 Indonesia, Johnson & Johnson, and also SIAP for having me here, and also ladies and gentlemen. I would like to start the presentations with a notions that by the end of our work today, there will be 4,000 people who will die because of this disease. Next slide, please. So we all know that this disease is an ancient disease. In 2020, there was an 18% of drop in the number of people newly diagnosed with TB. It was a very significant level of case notifications in the history of TB prevention and control. We go back to the level of 2012. So, and for the first time in a decade, the number of people who died from this disease also increased to 1.5 million. It is also estimated that if we miss in achieving the targets of end-TB by 2030, there will be 30 million TB deaths accumulatively, and also there will be 17.5 trillion economic loss from 2020 until 2050. Therefore, lack of adequate financing, ladies and gentlemen, remains the most important barrier in ending this disease. It is also estimated, according to the new global plan to end TB, that in order to get the world back on track in achieving the TB targets, we need at least 13 billion this year and 19.6 billion annually from 2023 until 2030. So we can achieve the end-TB target by 2030. But unfortunately, looking into last year, there was only 5.3 billion investment made in TB response. Therefore, we need to really accelerate the response in terms of the financing of tuberculosis. Talking specifically about the Asia Pacific, we all are aware that the Asia Pacific region is home to 60% of the world's populations. More than 4.3 billion people lives in this region. It also has 2/3 of the total global TB burden and the highest burden in terms of the multi-drug resistant variant of TB. So we have countries like India, China, and also Indonesia, which all together comprises of more than 30% of the global TB burden. Therefore, the Asia Pacific remains the most strategic regions if we want to address TB issues. And the conditions is worsens with the existing cases of malnutrition, for examples, diabetes, HIV, smoking, which all contributes to the spread of the disease. Now, allow me to speak a little bit about TB in the workplace. In my opinion, the greatest obstacles is that there is little to no information about TB in workplace. Another big issue is about TB in workplace is also presenteeism. So people either aren't entitled to sick leave when they're contracted by TB, they aren't aware that they can get it, or are reluctant to tell their employers that they might be sick because of fear of being dismissed. So it adds to the problem that needs to be addressed. Next slide, please. So in this slide, I want to show you the political commitment around TB in G20 context. As mentioned by previous speakers, the G20 member countries accounts for over 50% of all new TB infections and nearly 50% of all deaths due to TB. Since 2017 until 2021 last year, there has been major commitments made by the head of states and also health ministers to address these TB issues. All the big G20 TB countries have major mining sectors, especially prevalent in addressing the disease. Therefore, I think we have the foundations to address these issues, right? With Indonesia's commitment on TB, particularly in G20 context, we held the first side event on TB, which was very, very much historic in G20 response. And next year, India is also committed to continue TB as their priority. And also there are several other countries from G20 that we can learn For example, South Africa, who has a successful workplace TB programmings. So I think all the foundations are there to launch a major public-private partnerships focusing on TB and workplace. Next slide, please. In conclusions, I think it is the dream of the Indonesian G20 presidencies to recover together and recover stronger. But unfortunately, this won't happen if we don't address existing epidemic, particularly TB. Therefore, we need to strengthen the commitment and intensify the implementations of these existing commitments to address TB to the root. Thank you very much.
Thank you, Mr. Ganindra, for the presentation. Ladies and gentlemen, let's continue the event with the special remark from the Executive Director of the Global Fund to Fight AIDS, Tuberculosis, and Malaria, Mr. Peter Sands. To Mr. Sands, the screen is yours.
TB is the forgotten pandemic, a deadly airborne disease that has been killing people across the world for many centuries. In fact, TB is the second largest infectious disease killer after COVID-19. In 2020, TB killed more than 1.5 million people. TB kills people in their prime, when they're working, supporting their families, contributing to the economy. Quite apart from the human cost, TB costs the global economy more than $12 billion per year in lost productivity. And while TB disproportionately affects the poorest in society, it is often the poor in the somewhat richer countries. 50% of all TB infections and deaths are in G20 countries. The Global Fund is the largest source of all international financing for TB, providing 76% of the total. As of June 2022, the Global Fund has invested over $8.5 billion in fighting TB. But we know that beating TB will require not just the efforts of agencies like the Global Fund or national TB programs of civil society. It needs the private sector as well. The workplace is a prime location for spreading TB, but it can also be a fantastic place for defeating TB. That's why, with partners like Johnson & Johnson, Royal Philips, the Stop TB Partnership, we launched the Ending Workplace TB initiative at the World Economic Forum, creating a partnership to roll out awareness, detection, and treatment programs to reach millions of employees, their families, and their communities. For companies, fighting TB should be a no-brainer. If you employ thousands of staff in a high prevalence country, you will have staff with TB, both the latent and active forms. Losing them to the disease is not just a human tragedy, but a big business problem. Even when treatment for TB takes 6 to 12 months. Taking employees out of work for extended periods of time. The cost of combating TB in your workplace is a tiny fraction of the cost of TB to the business. From a global perspective, we absolutely need the private sector to step up. Because of the COVID-19 pandemic, we have seen the reversal of many years of hard-won gains in the fight against TB, and we need to regain that ground, and we need to do so urgently. Ending workplace TB is a practical, proven initiative that delivers results, and quickly, for individuals, for their families, and for the communities, as well as for the companies themselves. In Indonesia, Freeport McMoran is a great example of how, through participating in ending workplace TB, a leading mining company can deliver better health for its employees, for their families, and for the communities, and thus contribute in a very tangible way towards progress towards the Sustainable Development Goals. I want to close by commending Indonesia, and particular Minister Budi Sadikin, for their leadership through the G20 in putting TB high on the global health agenda. This is a pandemic we know how to beat and we can beat, but we need the private sector, through programs such as Ending Workplace TB, to be part of that fight. Thank you.
Thank you, Mr. Sanz, for the remark. Next is a speech on the importance of tuberculosis screening for future pandemic and infectious control, which will be delivered by the Acting Director of Communicable Disease Prevention and Control, Dr. Tiffany Tiara Pakasi. To Dr. Tiffany, the screen is yours.
Thank you. Good morning, distinguished guests, ladies and gentlemen. First of all, I would like to appreciate Johnson & Johnson for conducting a policy dialogue, bringing together stakeholders from various areas to talk about sustaining economic growth by managing tuberculosis in the workplace. My great appreciation also goes to the T20 Forum. Ladies and gentlemen, WHO declared tuberculosis a global emergency in 1993, and 66 million lives saved through global TB programs in the year of 2000. In Indonesian context, according to the Basic Health Survey of 2018, a total of 75% of tuberculosis cases are those of the productive age group, while the data from the TB recording and reporting system of 2019 and 2020 indicate that the age group of 25 to 29 years old has more TB cases compared to those of the younger and elderly age groups. Recently, the pandemic has harmed several healthcare systems, and for the first time in history, elevated the number of TB fatalities, undoing years of investment in the extermination of tuberculosis. By 2021, Indonesia is estimated to have 824,000 TB cases, following the highest mandate of TB control and prevention in Presidential Decree number 67 in the year of 2021. The National TB Prevention and Control Program committed to find and cure more people if the aim is to achieve the TB elimination target by 2030. As Indonesia holds the presidency of the G20 in 2022, under the theme Recover Together, Recover Stronger, we encourage the development of the global health architecture and promote essential TB services. Ladies and gentlemen, there are several items that we encourage in this presidency regarding TB response. To begin, TB monitoring and health information management system should be strengthened first. Systems for digital and real-time TB surveillance now provide automatic data quality checks, instant data access, and the availability of patient-level data for those with TB infection or sickness. To accelerate and bring the target on track, Indonesia will focus on the intensive use of active case finding and taking advantage of technology such as X-ray and artificial intelligence for the mass screening and targeted in the population that have a great risk exposure for tuberculosis. For example, is at the workplace. In addition to COVID-19, workplaces are prime locations for the spread of other respiratory pathogens, including common colds, influenza, and tuberculosis. Next, we need to employ novel diagnostics, drugs, shorter regimes, pediatrics formulations, TB preventive treatment, and innovative methods that maximize impact should be used more frequently. And third, fund TB research, capacity development, technology transfer, and the creation of new vaccines, therapies, and diagnostics in an appropriate and sustainable manner. Ladies and gentlemen, nearly 40% of TB patients are still not treated by the healthcare system, despite the present global investments in TB response and research. Governments, donors, and the business sector must seek increased funding for TB response and TB research in order to meet these objectives. It is estimated that to end the TB epidemic, the world needs at least $13 billion in 2022. In 2020, the COVID-19 pandemic pushed 100 million people into poverty, and the United Nations estimates that developing economies will have pandemic-related losses of 12 trillion US dollar through 2025. Therefore, during the first health working group, we encourage the G20 countries to make more wise investments for TB, especially in the need for the development of vaccines, treatments, and diagnostics innovations. During the first Health Working Group side event on TB progression, we are glad to share with you the significant update in the call to action on financing for TB response draft. And we expect that the call to action will be adopted as part of the declaration of the G20 health ministers. Finally, let me express my appreciation to the audience for your kind attention. Thank you very much. Over.
Thank you, Dr. Tiffany, for the speech. Ladies and gentlemen, let's continue the event with the panel discussion session, which will be led by Dr. Erlina Burhan as the moderator. Please allow me to read her bio. Dr. Erlina Burhan is a pulmonologist and a clinical researcher. She is also a lecturer and researcher at the Department of Pulmonology and Respiratory Medicine, Universitas Indonesia. A pulmonologist, head of tuberculosis research, as well as head of COVID-19 management at Persahabatan National Referral Hospital for respiratory diseases. Head of Infection Working Group at the Indonesian Society of Respirology, member and holder of various positions within the Indonesian Medical Association, member of Board of Director at the International Union Against the Tuberculosis and Lung Diseases. She also has various appointments with WHO for tuberculosis mission and development of tuberculosis guidelines and numerous publications on respiratory health and infection diseases. Ladies and gentlemen, before we are going to move forward with the panel discussion, we are going to hear the keynote speech delivered by the Minister of Health of the Republic of Indonesia, His Excellency Budi Gunawan Sadikin, who today will be represented by Dr. Maksi Rondonuwu. We are waiting for Dr. Maksi to join us. She will be joining us in a few minutes. Ladies and gentlemen, before we continue with the panel discussion session, once again, we are waiting for Dr. Maksi Rondonuwu, who will be delivering the keynote speech on behalf of the Minister of Health of the Republic of Indonesia, His Excellency Budi Gunadi Sadikin. Ladies and gentlemen, we have to inform that Dr. Maksi will be delayed, and therefore we continue with the panel discussion while waiting for Dr. Maksi. I want to quickly read the summary of Dr. Erlina Burhan's bio. She is going to be the moderator for our discussion today. Dr. Erlina Burhan is a pulmonologist and a clinical researcher who is also a lecturer and researcher at the Department of Pulmonology and Respiratory Medicine in Universitas Indonesia. And she also has various appointments with WHO for tuberculosis mission and development of tuberculosis guidelines and numerous publications on respiratory health and infectious diseases. Ladies and gentlemen, I now hand over the discussion session to Dr. Erlina Burhan.
Thank you, Rizky. I would like to welcome everyone again. Let me start with saying that TB or tuberculosis is the curable and preventable disease. We know the cause, Mycobacterium tuberculosis. We have the drug, and the drug are free. and also effective to cure TB, but somehow we failed in detection, in treating, and in reporting of the some of the cases. And this condition leads to missing cases. For instance, I would like to say that Indonesia have 824,000 new cases per year, but unfortunately the notification is only like 500,000, which is less than 60%. So why TB in the workplace is important? Because this is one of the strategy to find missing cases, to detect and treat. So ending TB in workplace will help us in as one of the strategy to target TB elimination in 2030, which is just in 7 years. So this webinar is very important, and we have also have 5 experienced speakers, panelists, and by the end of this discussion, it is expected that we can produce 1 or 2 policy briefs on the sustaining economic growth by managing tuberculosis in the workplace, to be published on the T20 website and forwarded to the G20 leadership. Okay, without further ado, I would like to invite our first panelist, Dr. Carla Decotelli Mendes, Master of Science. She is from Medical Affairs Leads, Global Health, Johnson & Johnson. Dr. Mendes has 20 years applied her population health knowledge in the private sector to strengthen employees' health program. And Dr. Mendes also joined GNG since 2017 and currently as Medical Affairs Lead in Global Public Health. Dr. Mendes, you have 5 to 8 minutes at the most to highlight some of the key points that you would like to deliver to the audience, and maybe last point, the summary of your insight. Thank you. Please, the screen is yours.
Thank you so much, Dr. for the opportunity. And as I have shared in the opening session, we have different settings in the workplace and different industries, supply chain and all of that. And with a stronger partnership with Global Fund that was also highlighted by Mr. Peter Sands, J&J, World Economic Forum, USAID India, South TB, and Royal Philips, in 2020 launched Ending Workplace TB Initiative. And that is that I wanted to share more about you as a good example on how we can use workplace very strategic, not only to tackle TB, but any other respiratory disease too. So Ending Workplace TB is an amazing, initiative that it's really bringing the workplace platform together with collaboration with different stakeholders and bringing the private sector together to share good practice, to share what each one is implementing. And it's really moving from a coalition to a community of practice. So what Ending Workplace TB did, we have, for instance, a member companies that are using, for instance, their diversity and inclusion platform and also program, and integrated with TB policy to reduce stigma at the workplace too, related with TB. We have other member companies, for instance, that it's partnering with the local health authorities to implement occupational health clinics and being able to do the early detection and the case finding to those populations that are now looking for healthcare system, but it's there at the workplace. So using that platform. We also have another member that is also using different screenings, integrating their programs for screening HIV, TB, and other diseases at the workplace too. So right now we have around 30 different companies collaborating, working close to identify good practice and how we could leverage and tackle TB at the workplace. One of the things also that through this coalition, during COVID-19, we were able also to see that a lot of the measures and interventions that we put it in place for COVID-19 was actually supporting the decreased spread of any other respiratory pathogen. And because of that, so for instance, having contact tracing, making sure that we were washing hands and having barriers at the workplace distance, and making sure that we having all the guidance for employees. These were measures that could also be leveraged to other respiratory pathogens, including TB. So what we are going to do now, ending workplace TB and this initiative, the main two work streams that we are working right now, one is really to build a community of practice. So we have been using the good practice, but how can we leverage? We also heard about the data and sharing good practice and things through the different speakers today. So this is something that the private sector together, also with Global Fund and Stop TB, trying to see how can we really use the workplace as a strategic way to tackle this. The other work stream is we are also working on developing a methodology on risk assessment. What that means is really trying to create a way that companies could assess how likely they are to spread any respiratory pathogens at their workplace. So with that, the companies could assess, see where they are, and then be able to put in place interventions to mitigate or totally eliminate that risk. So these are two main work streams that we are doing right now. And of course, there are a lot of opportunities for the future. It's really learning with COVID-19, all the different measures, and also getting prepared for any future pandemic, making sure that we have in place ways to monitor and support our workforce, and also working in partnership with the local health authorities. My really ask here is for all those private sector in G20 to join ending workplace TB. It is, we cannot do it alone. Each one has a role to play. And it is really important for us to work in collaboration. And always remember that good health is also good business. Thank you.
Ladies and gentlemen, before we proceed with the panel discussion session, we will allow the speech from on behalf of the Minister of Health of Republic of Indonesia is the keynote speech which will be presented by Dr. Maksi Rondonubu. To Dr. Maksi, the screen is yours. Dr. Maksi?
Excuse me, doctor, there is no sound.
You're still on mute.
Sorry. Yeah, thanks for this opportunity. Yeah, colleagues, speakers, ladies and gentlemen. First of all, apologies from the Ministry of Health. Mr. Budi has urgent matters that cannot be left. Thus, I represent him to deliver the speech. I would like to appreciate G20 forum that supported by Johnson & Johnson for conducting a policy dialogue, bringing together stakeholders from various areas to talk about sustaining economic growth by managing TB in the workplace. 2022 is the third year the world has faced the COVID-19 pandemic. Various challenges in society have been faced in various sectors of life, such as health, industry, education, tourism, and others. Ladies and gentlemen, today, despite our incredibly diverse nationalities, income level, and cultural background in G20 and beyond, we are reminded of our shared effort to overcome the pandemic with adaptive and dynamic strategies. To strengthen one another will eventually strengthen our collective self globally. Through the COVID-19 pandemic, we learned that failing to invest in preparedness leads to delay in fulfilling the rapid global demand during a health emergency. No single sector can tackle this challenge alone. Therefore, as the COVID-19 pandemic has started to abate globally, there is no better time than now to create a resilient global health system that work effectively before and during a health crisis. Ladies and gentlemen, currently Indonesia is entering a period of demographic bonus, where the number of productive age group is greater than the number of non-productive age group. Even the peak of the demographic bonus is expected to advance into 2030. The momentum of the demographic bonus must be maintained and utilized effectively. With the support of Johnson & Johnson to this event, I realized that the private sector is playing a big and crucial role in eradicating TB, particularly at the workplace level. At least the TB elimination by 2030, our sector must play an active role, private sector without exception, by controlling TB in the workplace. Thus, we can achieve a bigger things. First, maximize productivity by controlling and cure the people with TB symptoms earlier to avoid the later stage of TB. People who are ill with TB often lose a high number of days of work before they are diagnosed, and sick people can be as much as 20% less productive. Second, build resilience. TB is a latent respiratory pathogen and shares many symptoms and testing procedure with other respiratory diseases, including COVID-19. A strong workplace health system can fortify your workplace from various respiratory diseases. Third, a research suggests the strong workplace health system yield a net positive return on investment for companies. It is cheaper to invest in stopping disease in the first place and treating it when it arises. Ladies and gentlemen, TB is entirely preventable and curable. By improving collaborative networks and multilateral partnership, can we develop a robust environment to control the spreading of disease and still empower people affected by TB. Today, I would like to pay tribute to all of you, experts, advocates, practitioners, policymakers, and business leaders for your unwavering commitment and continued support to end TB. With this effort, not only will we provide the care that TB patients, families, and communities, but we will achieve the result we all want to see: a world free from TB by 2030. Thank you very much.
Thank you, Dr. Maksi, for the keynote speech. And now I hand over the discussion back to Dr. Erlina.
Yeah, thank you, Rizky. I'm so happy with the presentation of Dr. Mendes. She mentioned about the activity of contact tracing and also the risk assessment in the workplace, which is I do hope that the proper TB infection control is being in place. And also the good thing is that there's already 30 company that involving in this initiative. So I do hope that we can learn from this, and please, Dr. Mendes, invite Indonesia also to be including in this initiative. Yeah, okay. Now we would like to proceed with the next panelist. So we will hear the experience of India, how they do this screening, and also how they detect TB and manage TB in the workplace. This will be delivered by Dr. Kuldeep Sadeva. Dr. Sadeva is the Regional Director of Southeast Asia International Union Against Tuberculosis and Lung Disease. He's qualified as a public health and health management, and also chest and TB specialist over 32 years. So he is very experienced. I've met him in New Delhi a couple of times during WHO session. Dr. Sadeva, you have 5 to 8 minutes to deliver your topic. The screen is yours.
Thank you, Lina. First of all, thanks to organizers, Johnson and Johnson, for giving me an opportunity to be here. All dignitaries present in the meeting, my other co-panelists present here. Very good morning from India. So most earlier speakers have talked about why workplace TB. I'll try to give another counter narrative to it. The economic reason, of course, is there. It makes an economic sense to have screening at workplaces. In our country also, we noted that about 1760 million work days are lost annually due to sickness at the workplaces. TB also costs about $1.5 billion loss to economy annually in our country. But there is a huge workplace. Almost 40% of people work at some workplace, whether it's organized or unorganized. So we have about 470 million people who are employed. 20% are in the organized sector, rest 80% are in the unorganized sector. So when we talk of workplaces, unorganized sectors are as important as we are talking about the organized sector. And also out of 470 million who are employed, close to about 350 million are either self-employed or casual workers. So again, I'm referring to the unorganized sector. And many of them do not have health insurance coverage per se. So if we sort of implement TB screening in workplaces, it's an intervention, it's an entry point into their health screening and health and fitness in general. The secondly, more biological reason is that TB spreads by prolonged contact. And there are only two places where you can have that prolonged contact. One is your household, your home, the other is work. And you spend 50% of time in your workplace, 50% time in your household. While the TB strategy, most documents will say that you screen all household contacts of a TB patient. But I don't see a strategy which says you screen all workplace contact of a TB patient. So whereas the transmission in workplace is as important, and I heard Peterson, who said workplaces are also an excellent places to defeat TB, and I fully endorse that view. In fact, when we define interventions of TB preventive therapy, we should consider workplace as congregate settings where you can have a lot of spread of TB. Coming to the interventions which we are doing at workplaces, these are supported by USAID. Small investment, but huge returns. So we started way back in 2017 when we started engaging with for-profit corporates. The intervention is called Corporate TB Pledge. Started in a small way. We try to encourage corporates to get involved in TB, and the involvement was more tiered. So you can be involved in TB just by committing that you will commit to eliminate TB. The second step is that you commit to spread awareness of TB in your workplaces with your workforce. The third step is that you invest in TB. You put some money in TB. And fourth is where we call them as platinum members, is that you actually urge other corporates to invest in TB, get into TB control mission. So there are various graded steps in involvement, and we try to see that each corporate reaches the ultimate step where they act as champions, advocates, and encourage others to get involved. So far, we have about 250 for-profit corporates which are engaged with us at various levels. About 30 of them are at the topmost level, so they are champions. So one of my, which I should say in the last call for action would be that we should create champions out of corporate leaders and workplaces, union leaders, etc., organized sectors, so that they create a people's movement to eliminate TB from their respective countries. So we have a lot of experience in screening TB at workplaces. About 40 odd corporates have done that repeatedly with their workplaces around their geographies. And we have linked them with the national program, supported them with screening through by sort of putting things together and getting a gene expert machine, a mobile X-ray, a handheld X-ray, a mobile van, etc., and get them to do those workplace interventions. So far, small beginning, but almost 400,000 workers screened. About 25,000 tested for TB and about 1,500 detected with TB. But this is a good beginning, and it's all, now we have reached a stage where we are actually now exponentially growing. From 250, I'm aiming to reach about 1,000 in another 2 years with the corporates. One of the best involvement of corporates with us is Bombay Electric Suburban Transmission, an electricity transmission company, which has demonstrated over a period of last 3 years a 27% reduction in TB cases in their workplace, including their households, and a 50% reduction in sickness absenteeism. So it makes sense for corporate. There is an evidence to it now. We do a lot of workplace intervention with tea gardens, so tea sectors. So tea sectors is also congregate setting where a lot of transmission happens. And we have done repeated screening in tea gardens, and again, that's showing a good impact there. We are also extending this workplace interventions in sort of engaging with local communities around the plants or the workplaces, factories, etc. So they are adopting villages, they are adopting districts, etc. So they are also committing their resources that not only their workplace, they'll also sort of extend their reach to the local community, which is not in their work, not their sort of their employees, but they are sort of extended employees who should get that benefit. We also help now we are also helping corporates or companies to be compliant with environment, social, and governance norms, ESG norms, and give them a sustainability angle to the investing in TB. So investing in TB at workplace is also a sustainable activity for workplace. They contribute to environment, airborne infection control, they reduce infection at workplaces, they contribute to social, where they actually reduce absenteeism. They also place some incentives and see that if you are sick, you are given those benefits. And also they have in their policy, they say that we will not stigmatize patients with TB and other respiratory disease. So it's contributing to policy and governance also. So we are trying to link this with sustainability and employment, environment, social and governance issues. And that's getting a huge traction with corporates. Some of them are actually putting that in their annual reports, that how this TB interventions are helping them in this sustainability aspect of and governance aspect of this. We are also sort of engaging with local self-governments, politicians, legislators to raise the profile and how they can engage with local corporates to fill the gap for the TB program. So many corporates have actually donated handheld X-rays, the GeneXpert machines, cartridges, mobile vans, also volunteers for screening. Also, sometimes they offer their clinics and hospitals as a TB nodal point. So huge potential in workplaces addressing this. With J&J also, we have launched a campaign called Be the Change, which is sort of encouraging youth to come forward and sort of create a movement for TB. So my ultimate appeal or call for action is that let's engage with workplaces. Let's create champions, advocate, heroes out of corporate managers and workplace leaders to reach our goal of TB elimination. And we will help them to meet the sustainability and other ESG compliances with the regulators. It makes both an economic sense as well as a social sense. Over from my side, but I'll be open to any questions, clarifications.
Thank you, Dr. Sahdeva. We will have the panel discussion at the end of after everyone do the presentation. Yes. Thank you also for informing us the activity of TB in the workplace from India. I like about the Mumbai electricity activities. I used to know Mumbai is only from the Bollywood movie, but now we learn Mumbai electricity is also engaging in TB strategy in workplace, especially that they are linked with the TB national TB program, and also they are engaged also with the community and local government. This is a very good best practice, I would say. So thank you again. Then we proceed with our next speaker, Mr. Haryadi Sukamdhani. Mr. Haryadi Sukamdhani is the head of Indonesia Employee Association, or APindo. He is a very successful businessman, as I know. Yeah, and he got his master in management from the University of Indonesia, and also a PhD in management also from the Universitas Indonesia. Currently, Mr. Haryadi Sukamdhani is the chairman of Visit Wonderful Indonesia, member of advisory board of the Indonesian Chamber of Commerce, and then previously he was a president of Commissioner for Hipmi Jaya Foundation, and member of National Wage Committee, member of National Social Security Council, and many others. Okay, Pak Haryadi Sukamdhani, please present your 2 or 3 key points for this topic, and you have 8 minutes. The screen is yours.
Thank you, Ibu Erlina. Good morning, everyone. Can I have my screen? Thank you. Yep. So, Ibu Erlina, can you see my screen?
Yes, we can see the screen, Pak Sukamdhani.
Thank you. So, it's very interesting to have this webinar and also the explanation of the previous speaker. So I want to just only concentrate just only for the, I think just on the 3 or 4 slides. As you know, in Indonesia, we are the 3 largest of the TB case in the world, and the treatment success rate is 83% now. And this spreading of the disease, the TB disease, mostly impact to the productive age, as you see in this chart. So from the 15 years old up to the 64 years old, there's the most in this proportion. The stigma, Ibu Dr. Tiffany and also the previous speaker is already mentioned about this, mostly about the if the workers have the TB, then they forbid to work. This is that actually it's a worrisome. That's why they really afraid to seek the treatment. But during the pandemic, this is also impacted to the tracing. If you see it here, during the pandemic, the treatment, the tracing is really dropped. Then this is confirmed by the data from the Indonesian Healthcare Social Security or BPJS Kesehatan. This is very interesting of the data. If you see here, in the green table, this is the total of the members of the Indonesian Healthcare Social Security. So if you see here, this is the cases, and this is the number of the member which has the treatment. So this one, RITL, is the inpatient, and RGTL is the outpatient. So if you see here, our Indonesian Healthcare Social Security as the entity for the national coverage actually is starting in 2014. Then if you see here, effective in 2015. That's why the number of the member that affected by the TB, it's a jump from the 2014 to 2015. And if we look this number, I take from the outpatient case. So the case in 2014, 2015, it's a jump from the 136,000 up to 151,000. And also for the inpatient also like that. So these numbers is the relevant to the employee case in the right hand side in the peach color. If you see here, this is in 2014 and 2015, still below 50,000 cases. But in 2016, as the Indonesian Healthcare Social Security is effective, then it's a jump almost more than 2.6 times. And after that, in after 2016, the overall increase is about 48%, 4.8% up to 4.8%, 4.5 up to 4.8%. So it means that if the perspective of us as employer, we see that this is actually, it's getting better to control or to tracing the cases. Yes, in the 2020 and 2021, this is affected by the COVID, as my slide before. This is a drop the tracing, and because also the TB, it's related to the lung, and this is very close to the cause of the COVID-19. So that's why the numbers is decreased. But we should aware that the increase from the time to time before the COVID, it's about 4.5% to 4.8%. So let's say that the threshold is about 5%. So that's the case that we should monitoring. So if I can say in Indonesia, we hope that it more better to control since that we have the BPJS Kesehatan or Indonesian Healthcare Social Security System. Yeah, that's about the case. And actually in Indonesia, we also have the legal basis for the protection for the workers from the law of number 1 in the year 1970 up to the latest. We have also in 2016 regulation of Ministry of Health. So actually we are quite the system for the protection actually it's quite feasible. And this is the control of the workplace. We have the scheme is like this from the policy and commitment, integrated program, control and monitoring. Of course, all of this system, actually, we are really lean on the social security system, because from the screening of the through the healthcare system, it's more effective from us to treat to tracing and to make it a treatment. And this is my last slide. Yeah, this is the expected that we hope from the TB management in the workplace, that it needs a commitment from the management, from the trade union, and also of course for the workers to really have the cooperation to anticipate this TB in the workplace. And of course the protection, as I mentioned before, it's very important to join with the healthcare social security. And of course in the work environment, we need to again, the stigma that the workers or the employee that have the infection, they will still carry on the virus. Then actually this is also must be have enough socialization. So there is no discrimination for them. And of course the partnership, as we discussed today, we hope that this partnership will be enlarged, not just only in the social security system, but also the support from the pharmacy industries to have the cure and the effective to anticipate this disease. And of course, we hope that the benefit for all of us, for the workers, for the companies, and of course for the country. Thank you very much, Ibu Erlina.
Yes, thank you, Pak Haryadi Sukamdhani. Very interesting data that you show us. That actually, I agree with you that stigma is still the problem in the workplace, stigma of TB, and even though the detection shows increasing in the workplace, but yet decreasing due to COVID, which is okay. It's happened in many places. But still, I would like to say that TB stigma is far more dominant factor in deciding the successful TB management in workplace. I can say this because my experience in my daily practice. I have a lot of patients who are also employed at the industrial company, and when I diagnose them with TB, they then become very, very sad, because they said that, oh, please doctor, don't mention TB in my document. I'm afraid that I will be fired. So I think we need to have this kind of condition, that actually there are some legal protection with this employee, but maybe that this legal protection need to be disseminated or should be known by the employee. So education, including TB is preventable disease, and no stigma for TB, and also this legal protection. Thank you, Pak Haryadi Sukamdhani. So let's proceed with our next speaker. Our next speaker is also an Indonesian, but Mr. Ganendra Awang Kristandia, but he represent the Asia Pacific Regional Manager and from the Global TB Caucus. Mr. Kristandia is a graduate from University in Brawijaya, if I'm not mistaken, and apart from his the manager of Asia Pacific Regional, he is also a consultant for WHO headquarters to provide secretariat advice to the Civil Society Task Force on TB (CSTF) of the Global TB Program. And actually, Mr. Kristandia already did a presentation earlier, but I would like to invite him again here to deliver 2 or 3 key points of his presentation, and also maybe would like to have a summary statement. Please, Dr. Kristandia, Mr. Kristandia, the screen is yours.
Thank you very much, Dr. Erlina. It's always a pleasure to be in the same stage with you, virtual or in person.
Same here.
So I think we have established several understanding when we discuss about TB in workplace, right? We all agree that TB is a global and major public health issues. It's an ancient disease, as we all aware. So when Robert Koch first found the Mycobacterium bacteria in 1882, it has already been a disease way before that. I also remember that in Borobudur Temple, which was built 700 or 800 AD, so thousands of years ago, there is a relief telling a story about what we assume as people with tuberculosis. So it's been here in the world for so long, but unfortunately, even in the year 2022, it's still become a global health issues. And like Dr. Erlina mentions, the drugs are available, it's free, vaccines are available, even though there is a need to accelerate the developments and availability of safer, more effective and affordable vaccines, diagnostic, and also treatments. So what I'm trying to emphasize is that there has been lots of high-level commitments made by the head of states. So we have the United Nations Sustainable Development Goals with TB inside of it. We have United Nations high-level meeting on TB in 2018. We also have various G20 commitments and declarations and communiques in 2017. But the issues, the very big issues that needs to be addressed is how we can implement those high-level commitments, because clearly we are nowhere near reaching the targets of ending TB by 2030. And we also have established the understanding that TB in majority, it affects the productive age. Therefore, workplaces becomes the hotspot of the spread and should be more integrated into the overall TB preventions and control. So let's address the issues of implementation gap. In order for these commitments to be translated into changes on the ground, we need a strong push in terms of the implementations, because for far too long, these commitments remain as signatories, remain as documents on paper. Of major global health milestones, especially for TB, including the upcoming Global Health 7 replenishments, which Dr. Elliott, I'm sure, will speak a little bit about, and also the upcoming next year United Nations high-level meeting on TB. And I think in these occasions, because we will have Pak Charles, we had Ibu Tiara and also Pak Maksi, I think we had 2 messages for the Indonesian government. I think it's time for the Indonesian government to contribute to the Global Fund replenishment. That's one. And number 2, it is time for the Indonesian government to also be the co-facilitator of the United Nations high-level meeting on TB, which will happen next year in 2023. So I think these 2 call to actions is something that we direly needed in the global TB community. So, like I said, it is the dreams of the Indonesian G20 presidency to recover together and also recover stronger. Therefore, we need to strengthen the commitment and also intensify the implementations to address TB. We need a stronger public-private partnerships. Therefore, there is a bigger avenues for private sectors to play a pivotal role in addressing TBs, particularly in the workplace. Thank you, Dr. Erlina. Over to you.
Thank you, Pak Awang. Your role is very important. I like your role. You convince the government and especially the parliament, but we're still waiting for the result. Yeah, the parliament is something that very unique and also sometimes is stressful. Also having discussion with them, but I do hope that you can convince the parliament, especially that they would approve the increasing budget for TB. So good luck, Pak Awang. We will hearing from you. We will hear from you, especially for the success story. Okay, thank you. Since we are already talking about budget, so our last speaker is from Global Fund, Dr. Elliot Wantwalo. Dr. Elliot is from the Global Fund to fight AIDS, TB, and malaria. Let me read this is very small, but anyway, yeah. So Dr. Wantwalo, his medical his medical training in University of Dar es Salaam, Tanzania, and his master and PhD studies from Bergen University in Norway. So we will like to invite Dr. Wantwalo to give 2 or 3 important points regarding update of Global Fund strategy in TB program with specific area in Asia, and also please also inform us how this the framework of budgeting for the especially public-private mix, because the collaboration is not only with private but with the public sector, but private is also important, most important one. Please, Dr. Wantwalo, the screen is yours. You have 8 minutes.
Thank you, Dr. Elena, and good morning, colleagues from Geneva. It's almost 4:30 in the morning here in Geneva, very early, but I was compelled to attend this meeting in person because it's a very important meeting. And I would also like to extend my thanks to the government of Indonesia, JJ, and all stakeholders for inviting the Global Fund in this important meeting. So I will just give a little bit of highlight on the Global Fund and why it's important to work with all stakeholders to ensure that we have enough funding to support TB programs across the world, including initiatives such as End TB initiative at workplace. As you know, Global Fund is the largest international funder for tuberculosis, providing about 76% of all funding for TB, mainly in low and middle income countries. This is about 12% of all funding for tuberculosis. So funding Global Fund is critical, important for the fight of tuberculosis. If Global Fund is not well resourced, that means the fight to end TB will be delayed. And in most countries, and we have a few countries where majority of funding actually comes from Global Fund. So it's very critical that we ensure that the Global Fund is well resourced. In Asia, for example, where we have 60% of the global burden, we provide about 50% of all our TB allocation in these countries. Last year and the year before, during COVID pandemic, Global Fund did not only support mitigation against the 3 diseases, but also we supported countries to mount a response for COVID, where we provided almost 4 billion to help countries to have a good COVID response, but also to mitigate the impact of COVID on the 3 diseases. Our partnership model has been there for almost 20 years. It's a proven investment model, has really demonstrated extraordinary impact as a public-private partnership, saving almost 44 million lives since 2002. And during this partnership, we have seen a significant contribution from private sector of almost 4 billion. Although majority of our funding is coming from the public services, about 92%, but the contribution from private sector is very significant and is really playing a very complementing role, and is also not only we are depending on the private sector in terms of providing funding, but it's also providing innovative solution to end the 3 diseases. Global Fund is also working to catalyze other financing initiatives, mobilizing domestic resources, and we have seen through working with countries, we work to increase their domestic funding for tuberculosis, and the domestic funding has increased by almost 37% since 2016. We are also working to look at other blending financing mechanisms. Currently, we are working with the World Bank to see if we can have blending financing mechanism here in Indonesia as well as Pakistan, and we have worked as well for India, where we try to pool money together and using loan buy down to support countries to be able to mount their control program. I'll not speak much about ending TB initiative because other speakers have already spoken about it, but it's suffice to say that we are very proud to be the founder of this initiative with our colleagues from Johnson & Johnson and World Economic Forum. And we think fighting TB in workplace is not only the right thing to do, it makes economic sense, but it's very important, as other speakers have said, to mitigate the impact of stigma on tuberculosis. And this is critical. This will also help to overcome some of the barriers we are seeing in tuberculosis, especially when people think TB is only the disease of poor. But we have to show that everyone can get TB, but also fighting TB at workplace could be a very good advocacy tool to make sure that we get more funding from private sector to support TB efforts, but also getting more money from government and other sources to help TB fight. Because as we know, we are fighting this disease with a shortfall of funding. We have a huge gap in terms of the funding which is needed to fight the disease and funding which is available. Just a little bit about the Global Fund 7th replenishment. As you know, we'll have replenishment this year. Actually, next month in September, the United States will be hosting the replenishment of the Global Fund. We do that after every 3 years. And we have seen, since Global Fund was initiated, that we can, as a global community, fight this disease, which maybe 20 years ago, they were seemed to be impossible to fight, but we have made a lot of progress. With successful 7th replenishment, we hope to be able to save 20 million lives, cut the death rate from HIV, TB, malaria by almost 64%, and build a healthier and more equitable world. For TB, having a full replenished Global Fund will translate into reduction of new cases by 27% and also death by almost 59%. Under the 18 million replenishment target, which we want to collect, will increase TB funding by almost 40% in the next finance. So this will be a big boost in terms of, contributing to the fight of ending disease. As TB is the disease that needs largest boost in progress, it's therefore even more critical to have TB partners supporting the replenishment campaign to reach at least 18 billion. Now is the moment to fight for what counts and protect everyone everywhere from this deadly infectious disease and build a healthier and more equitable world. So thanks very much for this, and I'll be happy to take your questions and comments. Thank you very much, everyone.
Thank you, Dr. Elliot. It is very happy to hear that Global Fund now is also supporting the private sector to join effort in combating TB, especially managing TB on the private on the workplace. And we do all know that most of the workplace are private. So it is good to know about this support. I think we have all the panelists' presentation. Now I would like to open for discussion, and I see here one question already in the Q&A room. It is from Evindia PD, and this question is addressed to Pak Haryadi. Pak Haryadi, what is the policy of entrepreneurs in handling TB in their place of business? And therefore question. The next, does it provide special TB fund, such as providing medical expenses assistance to workers? B, how do employers monitor the treatment of workers with TB so they can recover quickly? Well, the duration is 6 months. And C, if a worker who is sick with TB goes to a healthcare facility for treatment, will their wage or salary be deducted? And the same question at the end is if there a worker who are sick with TB, their productivity decreases, will their wages or salary be cut? So please, Dr. Pak Haryadi, you have a comment on this question, but it is also open to maybe Dr. Elliot or Clara, and also I would like also to hear from the experience of Dr. Sahdeva from India. Dr. Please, Pak Haryadi.
Okay, thank you, Ibu Erlina. Yeah, Ibu Evindia. So the first question about the special TB funds, we don't have dedicated TB funds about this case, but we all the companies, it's already registered our employees to the BPJS Kesehatan, to the healthcare social security. And if there is still for some cases it still needs a more support, so we have a special policy about that. So not the TB fund is not dedicated because we have the BPJS Kesehatan, but if there is still needs extra because about some cases they need extra, as Ibu Erlina said about the 6-month treatment. So yes, a company they also support about this. The second question, how do employers monitor the treatment of workers with the TB so they recover quickly? So actually it's depend on the doctor approval. So we all it's monitor to the their doctor. So about the recover quickly, I think it's depend on the cases, yeah. But we really hear the advice of the doctor. And the third question, if a worker who is sick with TB goes to the healthcare facility, if they will their wages, salaries be deducted? This is more or less same with the fourth question. No, we don't deduct it about the employees that they infected by the TB disease. So they will pay the wage and salaries as normal. So this is actually in our regulation. It's already there. Yeah, that's the answer, Ibu Erlina. Thank you.
Pak Haryadi, actually every company, especially big industry, they do have the clinic, right?
Yeah, they have the clinic, yeah.
I want to add to that question that the clinic is responsible to monitor the treatment of TB. And one other thing that even though the duration is for 6 months, but actually after 2 months, the physical stamina and everything is already recovered. And I usually recommend the patient to work as usual if they already take the drug for 2 months, but they need to take the drug until 6 months. And this need to be monitored because we want this patient or the employer get cured completely.
Yes.
Is there any comment from other panelists regarding this question? Dr. Sahdeva, you have experience with this?
Alina, in our country, all workplaces with more than 10 employees, 10 is the benchmark, are covered by Social Security. So employer contributes towards their insurance. Treatment is, we generally link treatment with the national program. So responsibility for public health action, follow-up of patients, treatment completion, treatment outcomes lies with the public health program. Even if the patient is treated by the workplace medical officer, the responsibility to ensure that he completes treatment, adheres to treatment, lies with the national program. So that linkages we strongly ensure, and it's very much built into the national policy. Salaries and wages in organized sectors are taken care of. So they don't have to, there is no salary cut, there is no pay cut, that is within the social legislation itself. But when it comes to unorganized sector, then the problems are like in most countries. Less than 10 employees if you have in your workforce, which most for-profit corporates don't have, but unorganized sector or self-employed, they have to either buy the insurance, but they are also covered by country insurance now if they fall under a certain pay bracket. We call it below poverty line. So you fix up a benchmark salary. If your salary is less than that benchmark, you're covered, then the government takes care of it. But of course, there are challenges, and that is where we are actually engaging with the corporates to adopt patients. So a huge movement to adopt patient is currently ongoing. And almost 3/4 of our patients have been adopted by either an individual or an organization or some philanthropist or something like that, that they will take care of the entire treatment course of that patient. If they need additional support, nutritional support, that will be taken care of. This is not much, so much in monetary value. It's just about, say, $15 for 6 months of nutritional support or something like that. So money is not huge, commitment is huge. So a huge drive to adopt patients by corporate sector, and it's getting traction now. I would urge, I think most countries can replicate the model. If they need some guidance, etc., we have a good experience in that.
Thank you, Dr. Kuldeep. I think the situation more or less similar with us here in Indonesia, that the employee is also covered by the security health system. Yeah, but the question is if they do not go to work because of they got ill, whether they not really salary here, but the transportation support fee and meal support fee is still there, but I think the salary is there, but some how? Because they do not go to the office, they don't get the transportation additional fee and also the lunch fee, etc. Correct me if I'm wrong, Pak Haryadi.
Yes, Ibu Erlina. Some of the labor-intensive industry, they put like that, so they make it like a variable cost about the transportation and a lunch. But some of the companies actually they already put it as a lump sum. Yeah. So
Okay.
yeah, it's depend on the industry. Thank you.
All right. So, but what the experience from India is that the patient is also linked with the NGO, right? So they get like food basket, etc., and getting like $15 per month. Dr. Kuldip, is that true?
It's maximum of $15 a month.
Yeah, but that is not from the employer, not from the industry, but from the NGO, right?
It's mainly from industry, not from the NGOs. NGOs may be implementing those interventions. It's mainly from the industry and philanthropists. It can be individuals. I can adopt 5 patients and say, okay, I'll take care of them, their support while they are on treatment.
Pak Haryadi, will that experience or example from India can be also applied in our setting, that those who are getting sick of TB will get additional incentive?
Yeah, as I said, some of the cases, Ibu Erlina, that takes more than the capacity of the Social Security funding. So the company actually also support on these extra expenses. Yeah.
Okay, Pak Awang, you have any comment on this condition? And then next I will go to Dr. Clara.
Thank you, Dr. Erlina. I think one aspect that needs to be strengthened is definitely how we engage with civil society. And in this case, is the unions of the workforce. Because I think Pak Haryadi also mentions how the stigma, the self-stigma within people with TB is still very strong in the context of workplace. People are either not aware that they are entitled to certain rights, leave, and also certain benefits when they're contracted to TB. So I think engaging with them, involving them in the developments of the policies when we address TB in the particular workplace, I think that's a crucial aspect.
Sorry about yeah, this is very important, Ibu Erlina, about the stigma, yeah, because many of them, yes, as your experience, they are really afraid that in their health record there is a stated about the TB. So I think it needs also from the Ministry of Health to make like the what you call like the in Indonesia we call it the surat edaran, yeah, or the announcement from the Ministry of Health that this is this actually it's can be managed, and it's not it's not need to be a stigma is like that. So I think this is the clarification of the government. I think is very important, because many of the companies, yes, they are still not in the written, Bu Erlina, but when they see the record, then yeah, they have the discrimination. Thank you.
Yeah, you are very true, Pak Haryadi. Some patients are afraid they will get fired because they're getting TB. So this is a stigma and discrimination. Maybe they do not know that there is also actually like the decree or law from the labor association that those employees who got TB cannot be fired, but they need to be supported, facilitated, having access for diagnosis and treatment. I forgot which chapter, but I heard about that. So maybe this kind of aspect need to be disseminated. So yes, we are having a lot of homework for this TB education in the workplace. So maybe after this, we can put in the policy brief that we need to put this TB in the workplace as a education activities among the workers and also in the workplace. And yeah, I have problem, as I mentioned. Sometimes I need to write a letter to the Human Resources Department stating that this patient is already being treated and he's okay and he's fit to be to work as other patient. But sometimes if this happen many times, I get tired writing a letter. But if this already in the policy, maybe doctor do not need to write a letter to the Human Resources Department of the company. Okay, Dr. Mendes, Clara, you have a comment regarding this?
No, thank you, Dr. Lina, and all the speakers too. One important piece, and even thinking from a global corporation like Johnson & Johnson, we will always, the companies, follow the legal requirements. So really seeing what is implemented in that country, the recommendations, those requirements, it's really the first step to see how we are going to be implementing the programs. The second guiding principle related to that, it's really how we can integrate with existing policies in the company globally. So for instance, I gave an example from another member from Ending Workplace TB that really integrated TB stigma into the diversity and inclusion policy that they have, making sure that they were fighting that on as part of a corporate policy too. So the other thing is, for instance, specific for us, Johnson & Johnson, we really try to see a holistic respiratory preventive for employees. So when we have an employee that we are doing health screening or doing the health questionnaires related to their respiratory health, we try to see it other things too. So for instance, we provide smoke cessation program, right? If there is a smoke component as part of it. So trying to, as a second guiding principle, having integrated strategies with health promotion, health and well-being in the company, maybe diversity and inclusion policies or other things would be the second step. But for sure, the first one is the legal requirements of the country and really making sure that we are compliant and taking all advantage of that. Thank you.
Thank you, Clara, for the additional information. I think you are very correct that integrating local strategy with the global corporate strategy will help. Yeah, maybe this statement can be put in our policy draft later on. Yes. Dr. Elliot, would you like to give a comment on this?
Yeah, I just want to add that ending catastrophic cost is one of the end TB strategy. And in fact, that is supposed to be attained by 2020. But studies from WHO and others have shown we are not there. We are not even half of that. And that includes also supporting workers at workplace. Treatment of tuberculosis is not that expensive. What is more expensive is really things surrounding treatment, you know, transport costs and other costs surrounding. So I think we need to make sure as we push for these workplace programs, we ensure that they do take care of the employee, not only in terms of the treatment, but also supporting the other elements when someone is on treatment, including stigma, including families, etc. Us as a Global Fund, we do support patients, especially the poorer patients. You know, we provide enablers, for example, especially for people with drug-resistant tuberculosis. But as you know, resources are not enough. So we really need to work with workplace to ensure they take patients holistically, not only in terms of treatment, but other elements which, you know, going together with tuberculosis.
Yeah, thank you, Dr. Elliot. I think if Global Fund also provide these enablers in the private sector, and we can adopt this, and maybe we can synergize this activity with our national program. And knowing this, I think the patient will love you very much. Yeah, I saw Dr. Kuldeep also raising hand. Please, Dr. Kuldeep, you want to add?
I just wanted to make a distinction. Thanks, Lena. Between workplace intervention, which corporates do, it's more sensitization, screening of those who come forward. The other intervention, I said, adopting TB patients by anybody, individuals, philanthropists, NGOs, for profit. They are the public sector to address stigma. In fact, seeks concurrence from the patient first, that they are willing for somebody to approach them to support them. This I wanted to make it clear that it's a patient choice whether they want that support for adoption, for any kind of support, whether nutrition, livelihood, any other catastrophic cause. They have to first agree to it, and then we sort of allow people to approach them. So just a clarification.
Yeah, thank you, Dr. Kuldeep. India has a lot of philanthropists. I know that. Actually, the same thing is also in Indonesia. We do also have a lot of philanthropists, and I would like to, not asking, but maybe Dr. Haryadi Sukamdhani have an access to those philanthropists. Maybe if Pak Haryadi can help our national TB program by engaging also those philanthropists from Indonesia to help with this incentive, etc. I think this is one of the strategy that can not only detect but also to increasing the treatment success in the workplace, and also doing the what Carla has mentioned, doing the contact tracing, and also risk assessment, and develop this what so-called TB infection control in the workplace. And Carla, you mentioned earlier that in your early presentation that this ending TB in workplace initiative is already launched and involving 30 big companies and also a lot of other private sector. So I want to ask you how to join this initiative. Is there any special strategy? Please advise.
No, thank you, Dr. Lena. So as shared, it was launched in 2020 at Davos, and now with around 30 companies, and any company from any sector, any industry can join. And it's really, we do have a website that is Ending Workplace TB, so EWTB.org. And over there is also how to join. The major things I just want to highlight, it is opening, there is no fee to join on this. It's really to be able to comply with 4 major pillars. First is to be committed as a company to raise awareness on TB. Second is to identify a focal point in the company to be working close with the Ending Workplace TB team. Also be able to work close with the Ending Workplace TB in terms of costs as interventions, and be willing to share good practice with other companies too. And fourth is encouraging the suppliers. So all the companies, and no matter which size, they have also suppliers and contractors working with them. So it's really to create that kind of chain reaction and engagement and collaboration. So it is the fourth commitment that a company that joins Ending Workplace TB should also have that commitment on engaging their supply chain and also providers. So these are the major 4 pillars, but it's open, and I think that is where we were talking about collaboration and different stakeholders are moving the needle and ending workplace TB. Thank you.
It sounds easy to me. Yeah? No need to pay, just need to contact the website that you mentioned, but unfortunately I forgot to write it down. So maybe the local committee notice that website, or maybe Carla, would you kind enough the website that need to be contacted? Yeah, thank you very much. So there is another question in the Q&A room from Dr. Subhan Rahim, MPH. The role of decision marker at the regional level or district level, I think it is also necessary to strengthen, not only with make specific regulation in that area, but also consistent monitoring and implementation of the regulation to the workplace level on the district. This is something I see need to be monitored and measured, including push the public-private mix activity. Yeah, any comment on this statement from Dr. Subhan Rahim? I kind of agree. Why? Because actually all the SOP, the guideline are very good. It is developed in the very proper way, but our weakness is that the implementation. So that's why I see that monitoring of implementation of some guideline or SOP is very important. That is my comment as moderator, but I need also the comment from the panelists. Pak Awang, you want to volunteer to give comment on that?
Absolutely, Dr. Erlina. I think these issues in terms of health decentralizations is not exclusive in Indonesia only, because health decentralizations is also happening in various countries. And in terms of that, I think one of the challenges is how we can translate the regulations from the national level onto the provincial, district, and even to the very local level to implement the programs. And I think that's the challenge, especially in Indonesia, because a lot of national commitments are not that well translated on the ground because of different health priorities in the districts or provincial levels. So I think one of the strategy is for us to ensure a stronger engagement with all aspects of the system. So not only engaging with the private sectors, the public sectors, we engage with the members of parliaments as well, because they are the one who will be able to push for stronger oversight over the implementations of the program on the ground. This is something that we have also encouraged our national and local partners to do, is to engage the subnational levels of parliaments to push for stronger oversight in terms of the program implementations. So I think that's my response, Dr. Erlina. I completely agree that it is very important to have all the regulations translated into local context.
Yeah, agree with you also, Pak Awang. Dr. Kuldip, you have a comment on this?
So there's no doubt whatever gets monitored gets done. So monitoring and evaluation, of course, is the prime thing. We are not very keen to regulate the sector per se. We work more on facilitation, how we can engage in a more in a partnership mode. So whatever regulations are there, there is a regulation which says that you have to notify all TB patients if detected. So that's the only piece of regulation. Besides that, we are trying to engage in a more partnership mode with the corporates, and that seems to be working fine. I mean, it's an appeal to them for a general good of the. It's also, we are trying to bring out co-benefits even to the workplaces in terms of compliance with other requirements of the other ministry, which is Ministry of Corporate Affairs. So all corporates are regulated by some other ministry. So we say we will help you to meet those compliances related to your sustainability, etc. So we work more on the advocacy side of it.
Okay, so Pak Haryadi, any comment?
Yeah, similar with Pak Ganendra. Yeah, I think um, uh, the implementation on the ground, it's really depend on the situation on the ground, because some of the situation, the authority who handle this, sometimes they don't also really understand of the national regulation, Ibu Erlina. So I think in the workplace, especially for the corporation, since we have the healthcare social security, BPJS Kesehatan, it's for us, it's really helpful. It's really make us easier to handling these TB cases. But I'm not sure about for the people, yeah, because in the company, the corporation, of course we will taking care of our employees. So the monitoring, it's more intensive than the others. So I think, yeah, this is, I think, our homework for the regional level. Thank you.
Komisi. Ya, oke. Oke, Pak Haryadi. Actually, we have another couple of questions, but we have our special guest here from our parliament, Pak Charles, and from the Commission 9, especially focused in the health matters. So I would like to invite Pak Charles also.
Yes, hello, good morning.
Good morning, Pak Charles.
Good morning, Dr. Erlina. How are you?
Fine, Pak Charles, we are very good. So we have a very good discussion. Ibu Santi is also here, and also Pak Hasbullah. Ibu Santi, would you like to have some introduction to Pak Charles, because Pak Charles just joined us.
Yes, thank you for that, Dr. Erlina, and Pak Charles, thank you for taking out the time. We have invited a different speaker today for his observations, because what we have done today is we have heard from the government side, we have heard from the private sector side, and we have heard from the industry side. But we really want to hear from the parliament side, because as mentioned earlier by Pak Ganendra, political will is really important in tackling this. We are all trying to form an ecosystem where people with TB feels comfortable, feel confident that they don't lose their job, and they can still function as a normal member in the community. However, the regulations need to support that. And the implementing side needs to be equally balanced. So we would like to invite Pak Charles today. Pak Charles, if you can share with us a few of your observations from the Parliament perspective, and if you have some ongoing programs or some other insightful messages that you would like to share us, please do so, Pak. The screen is yours, Pak.
Thank you, Ibu Santi. First of all, I'd like to greet all speakers, guests, participants, colleagues, audiences. A very good afternoon and a good day to all of you. And first of all, I would like to extend our appreciation to the T20 Indonesia for inviting us to represent the House of Representatives of Indonesia to this very important webinar, as I believe all of us would agree that tuberculosis remains a very significant and important global health problem today, especially for us in Indonesia, seeing that Indonesia is, if I'm not mistaken, the second highest country with the second highest rate of TB prevalence in the world. At the moment, from what I have gathered, the data that we have gathered, every day around 4,100 people, including 700 children, die from this preventable and actually curable disease. This is a wake-up call for all of us, and this is a wake-up call for us to take a real, tangible, collaborative action to achieve the NTB goals, in 2030. The House of Representatives of the Republic of Indonesia fully supports the NTB's initiatives and commitments led by the Indonesia's G20 presidency. The House of Representatives have strategic functions and roles in shaping and supervising national policies to control and eradicate tuberculosis, including approving the national budget allocated each year for tuberculosis eradication. We are truly and deeply concerned of Indonesia as the country with the third highest rank and the second highest TB burden in the world, according to the WHO Global TB Report of 2021. And due to the COVID-19 pandemic, there has been an increase in the number of people dying from TB to 1.5 million. And deaths from tuberculosis from 2015 to 2030 will cost Indonesia 0.7% or 123.6 billion US dollars of its gross domestic product. And if Indonesia succeeds in eliminating TB by 2030, the economic loss that can be avoided is 1.3 trillion US dollars. The condition is slightly better than the previous year's report when Indonesia was second highest. We do believe that this improvement has resulted from the House of Representatives' support to double the state budget allocation for tuberculosis since 2019. As we all agree, funding is certainly a key element to sustain the effort to end tuberculosis. Being said that, we support what has been agreed in the G20 First Health Working Group side event on tuberculosis on 29th to 30th of March to call G20 members to increase funding for tuberculosis. Considering 50% of the global TB burden is in the G20 members, allocating only 0.01% of the collective GDP of $66 trillion for tuberculosis is disproportionate. We can do better and we can do more to combat this curable and preventable disease by increasing funding for TB eradication. We have learned from the global effort to control the COVID-19 pandemic, and the collective lessons have to be accelerated to end tuberculosis. Global actions are required urgently to create more partnership, more funding, more innovation, and a more forward-looking policy. It is also important to note that the enactment of Presidential Regulation number 67 of 2021 on the prevention of tuberculosis is a big leap for TB control efforts in Indonesia. This regulation does not only become the basis for the strengthening of coordination, but also it strengthens the cross-sectoral and multi-stakeholder collaboration in accelerating tuberculosis control efforts. Therefore, the implementation of this presidential regulation requires the involvement of various stakeholders, including the executive branch and the legislative branch of government, the business sector, the civil society, and the community as a whole. The importance of the involvement of the legislative branch in TB control efforts cannot be separated from its functions, namely the legislative functions, the budgeting functions, and the oversight function. Through the legislative function, the legislative branch can strengthen the government's commitment to tuberculosis control by encouraging the drafting of for bills on tuberculosis control and eradication. Through the budgeting function, the legislative body can ensure that the funding needed for TB control can be met by a government's budget plan. Although I have to say, until today, the amount of funds approved and used by the government is still far from adequate of what is needed to eradicate tuberculosis in Indonesia. And through the supervisory function, the legislative branch can play a role in ensuring accountability for TB control efforts in Indonesia. In addition to its functions, the legislative branch also has the authority to absorb, collect, and follow up on aspirations of the community so that the tuberculosis stakeholders can find out the community's needs related to TB eradication. We at the Commission 9 of the House of Representatives have been working very closely with the Ministry of Health and other key stakeholders to ensure that the policy for tuberculosis eradication programs in Indonesia is implemented well in Indonesia. However, one of the big challenges is improving tuberculosis multi-drug resistance treatment and management. Another challenge actually is how we can strengthen our effort to mainstream TB control in workplaces. Hence, we need to accelerate our partnership with the government, stakeholders, and the private sector to improve the policy implementation. Especially, the focus is to improve awareness among workers on the TB, as well as encourage the working place to have certain policies to protect and to care for workers who are exposed to tuberculosis. Currently, we also work together with the TB Partnership, Global TB Caucus, supported by other key stakeholders to form a national TB caucus to streamline our roles in ending tuberculosis in Indonesia. Moreover, not only in Commission 9, the House of Representatives Interparliamentary Cooperation Body, which I am also a member, has advocated for a more collaborative partnership with parliaments in G20 member countries as part of Indonesia's P20 presidency, which is currently chaired by our speaker, our Madam Puan Maharani, to achieve the Sustainable Development Goals, one of which is ending tuberculosis. Once again, achieving these goals require commitment, collaboration, and sustainable funding, which I urge every single one of us here to pledge to be part of, to end the TB, to end the tuberculosis in Indonesia and in the world. I am very grateful and honored to be speaking in this forum. And again, I believe that through Gotong Royong, this is a spirit that we know as a nation in Indonesia that we use to overcome the different problems that we face in our country day by day, including how we overcome the COVID-19 pandemic. Through Gotong Royong, we can also overcome tuberculosis in Indonesia and hopefully in the region and all across the world. Once again, thank you very much, and thank you for inviting us in this webinar.
Yeah, thank you, Pak Charles. One message from me, Pak. Yeah, please endorse also the government, since you are the chairman of the Commission 9 that focus in health. Please endorse government to increase the budget for TB in general, including the workplace. Thank you, Pak.
Yes, Bu. Thank you. Thank you, Bu.
Okay, Ibu Santi, may I continue with the discussion?
Yes, Doctor. Please continue with the Q&A. Thank you.
So we still have like 10 minutes to go. So I have one last topic. During pandemic, the collaboration of the stakeholder focusing mainly for COVID. But there is a lesson learned from COVID. There is a silver lining that we want to see it from the TB aspect. So, do you think we can have this silver lining like a 3T in COVID, tracing, testing, and treatment, and other collaboration can be implemented for TB and increasing TB yield, not only in detection, also the success rate and also the notification, and maybe also contact tracing and TPT, TB preventive treatment. So I would like to ask to invite everyone to give comment on these issues. Yeah, Dr. Elliot, would you like to go first?
Sure. Yeah, you are right. There is a huge overlap between COVID and tuberculosis, and we have seen early in the pandemic, TB was the most affected disease. Generally, for Global Fund, we have seen a reduction last year of 18% in terms of the targets for most countries which we are supporting. And if you look at the impact of COVID, was not much in Asia, for example, compared to Africa. And there are a lot of lessons which could be learned from COVID, which could be essential for TB and probably even ending TB. First of the lesson we learned as at the Global Fund, you need to work very fast. I think COVID showed us things which sometimes take years, could take months, maybe weeks, even days. We have seen how the world mobilized itself, getting resources to fight COVID. It took so many years to put TB into attention, but for COVID, money was available to be able to do that. So we think the machinery of resource mobilization, which was deployed for COVID, could be handy for tuberculosis, because both are respiratory disease. Even for preparation for the next pandemic, is likely to be a respiratory pandemic, which you could use a lot of lessons from TB to be able to do. So I think one of the area we learned is that TB need to learn the machinery of resource mobilization, which was deployed for COVID, which could be also very useful for tuberculosis. The other important lessons, we need really to work across the board to strengthen not only TB program, but overall health system. What we have seen...
Doctor.
Sorry?
I agree with you.
Yeah, exactly. So what we have seen across the board is that countries which prepared themselves have very robust, resilient system for health, and not only health, but also community recovered very fast, and they were very resilient during COVID. So what it means for TB, I think what it means for TB, we really need to make sure that while we are fighting TB, we are also building community and health system. It doesn't have to be just TB, but it has to go across with other disease. And the other area is around innovation. We really need to deploy that fast. In TB, we have been very slow when it comes to innovation. For example, when it comes to diagnosis, WHO 10 years ago recommended that every TB patient should be diagnosed using molecular technology. But up to now, it's only 1 in 3 patients who are being diagnosed using molecular technology 10 years after the recommendation. And this is very low. I think we need to move very fast on that. Every patient should be diagnosed using the latest available technology, which is molecular technology. And we should get away from diagnosing people using 100 years technology, which is microscope. So I'll stop there, but there are so many parallel and lessons from COVID which could be used for TB.
Okay, thank you, Dr. Elliot. I think I have to stop now because we already come to the end of our session. I just need to mention maybe just a summary for just 1 minute. First, we need to strengthen the commitment and intensify the existing implementation of government, private sector, parliament, NGO in order to lead and workplace TB initiative. Yeah. So the second is to improve the provision of the law that regulate TB in the workplace, and this is maybe include the socialization, dissemination, company support, additional incentive, and also affirmative action from the company. I end it with that, and since the time is over, I will offer it to Ibu Santi to really close the meeting. Over to you, Ibu Santi.
We would like to thank our panelists as well as Dr. Erlina Burhan as our moderator. Thank you so much for such an insightful session. We also would like to thank Mr. Charles Honoris for the support. Ladies and gentlemen, before we close the event, we would like to invite the co-chair of T20 Task Force 6 and also the founder and CEO of SAYAC, Ms. Shanti Samdasani. To Ms. Shanti, the screen is yours.
Thank you for that, Rama, Dr. Erlina, Pak Haryadi, Dr. Carla, Dr. Kuldeep, Dr. Elud. I think it's a really great session, great discussion. We have quite a big number of show up as well here today. And what I would like to summarize, looking at the whole discussion of the panel today. Yes, we have local regulations in place. Yes, we have the right government regulations. Yes, we have, even companies have their own regulations in terms of how to, treat their employees who have contracted TB. However, there is one thing which I see we still have a big homework and a big advocacy work on, which is the stigma. And this is no matter what the company does or the company says, sometimes the stigma, when your doctor tells you you have TB, that kind of like really throw up the whole thing, and you begin to isolate yourself, not just from the workspace, but also from the family members. It's kind of like a stigma where people, you have TB, now you cannot go out of the room, you cannot breathe the same air, and things like that, whereas it is totally curable. There is a medicine for that. All we need to do is to be diligently at the right time every day taking the medication, and within 3-4 months or even before that, you're actually okay. Now, this is something where I think we need to advocate further. And I think to Pak Haryadi here, because you are the chair, you're the head of the Indonesian Employer Association. You have thousands of large companies with factories under you. But I think if we can follow this up, and maybe, with the support of other private sector, if we can follow this up, this should not just end at the G20 level. This should be continued forward. And what I want to do is to see if we can come together, both government, parliament, and the private sector, and follow this agenda up, because it is an important agenda, and this is not an agenda where it can be solved in one night. So Pak Haryadi, we may be contacting you again to see how we can reach out to the companies, how we can work. You have what, right, around 132,000 members? Is that the number correct? Not quite sure, but I know it's a big number, Pak.
About 15,000.
15,000, okay. So 15,000 companies under you, I think that's also very good, a very good way to start. And also to Pak Ganendra, I would like to see how we can continue to work closely to build political will. And to Pak Charles Honoris, I want to see how we can, maybe after this we'll visit the Parliament office and we can sit down together and see how we can support you in your national committee for TB. I think this is something that not one single person can do on their own. This requires collaboration of many parties. So I think with this, and of course the Global Fund, one of the most important element to this, and I'm so glad Dr. Elud and that you are here today, and you provided the support to us and also to Dr. Kuldeep. I think what India is doing is something that we need to look at the best practices, and we need to see how we can implement that in Indonesia, not just in the year of the G20, but also moving forward. So I think this is one area we have a lot of homeworks to do today. It is no doubt a very good discussion, absolutely great discussion, but it also leaves us with a lot of homework to follow up the works. Otherwise, this will just be a good to have discussion, and then there's no follow up. With the panelists today, very good panelists. We have the government, the parliament, and the private sector, a perfect blend to make the future plans and the future framework to move TB, especially in the workplace, because a workplace is a closed environment, and this is one area where it is most vulnerable. Again, I would like to thank to all our speakers and our panelists. And before we close, I would like to wish again one more time our minister speedy recovery. He was supposed to show up today, but because he have contracted COVID, so he's taking a bed rest. So we wish him a speedy recovery. And to all the participants and the panelists, moderator, Dr. Erlina, thank you for moderating such a good session. Absolutely wonderful. And thank you again, and have a good day. And to those who woke up in the morning, have a good rest of the day. Dr. Carla, have a good night. I'm sure it's late there for you. But thank you again, and see you in the next session. Have a good day.
Bye, everyone.
Thank you, Ms. Shanti Samdasani, for the remark. Ladies and gentlemen, that marks the end of today's webinar. We would like to thank all of the speakers, moderator, and participants for joining us today. The recording of this event is available on YouTube, link as shown on the screen. Once again, we thank you for your participation and have a good day.